Hi, this is Brandy Schantz, and you're listening to Living Chronic. Today I'm here with Dr. Tara Palumbo. She, much like myself, is dealing with autonomic dysfunction as well as a number of other diseases. I'm really excited for this particular episode because being a doctor, of course, you've spent over 30 years in the medical industry and now you are a patient. So you're going to have a really interesting perspective that those of us have never worked in medicine or, from how we view it. So excited to have you on. Welcome.
Why, thank you. Happy to be here.
So you have been in the medical industry for over 30 years, and you've said that you've seen so many changes since you began. So could you tell me a little bit more about what some of the bigger changes are that you've seen since you started?
Sure. So I started in healthcare, I guess the very early 90s. Well, 1990 is when I
Mm,
actually started, and started as a medical assistant working in doctor's offices and specialist office. And, the talk then was about an EMR that would be all encompassing, where
hmm
everybody's all patients' information would go into one single warehouse repository, meaning an
hmm
electrical warehouse,
hmm
technologically speaking. And, we were all excited about that, knowing that paper charts would go away and that one day we'd be able to look up a patient and see all of their medical records from all their doctors in one place. And of
hmm
course, that's how it's used in universal healthcare, but that is not how it happened. So, as everybody knows, there's multiple electronic medical records, EMR. So, you can go to one hospital system that doesn't communicate with another hospital system and have multiple doctors in all these different systems and then not communicate. However, now they're starting to make that happen. And by not doing so, it shows a decrease in patient care, patient communication between doctors, as well as pharmaceuticals. When they get their prescriptions called into pharmacies, some of those pharmacists pick up some of those contraindications and will call another doctor and say, well, this isn't a good doctor. Or what they're doing now, for me at least, they're just saying, oh, we're not filling this because it doesn't communicate with another one of your drugs, but doesn't explain why. So it leaves us all hanging. And as well as preventative care has gone to the wayside, communication through being a public health doctor, seeing those pop up on the TV when we were young saying this is a public service announcement, they don't exist anymore. Just like, health class is not what it used to be.
Right.
And children aren't even learning basic, information, sex education, because parents don't want them to know about their own bodies and, why they're having nocturnal emissions or why a woman's getting or a little girl's getting her period just like an older woman. So, kids just don't know what they're walking into, let alone older people walking into a convoluted bureaucratic healthcare system that is made to be a detriment to all of us.
Yeah, coming from a different perspective. So, of course, I was in the Army. My father was in the Navy. So essentially, now of course I'm a veteran. My husband was in the Army. He's now retired. Essentially, I've spent my entire life in the military medical system, and they know everything about me from the day I was born.
Mhm.
And that's very, very much true because they do have all of my records in one place. It makes my Veterans Affairs stuff quite easy because they know everything about me. They have every record since the beginning of time for me. But yeah, when we go into these other systems, and I've reached outside of the military medical system pretty frequently, it's exactly as you describe it. I find it's very disjointed. There's no one to help me, and largely I have gotten my diagnosis entirely of my own volition and work. I'm the one who did the research. I'm the one who went through all the NIH articles, taking
Yep.
weeks to get through them because I am not a scientist or a doctor or anything of the kind. And it's been very interesting to me as somebody looking outside in how much work a patient really is expected to do for their own care. And when speak with somebody like you who is a doctor who's struggling with this, I always think, what are the people doing who just don't have the resources that we do? How are they getting to their diagnosis, to their care, to the right prescription for them, the right treatment plan? And you probably know more about this than anybody because you do work public health and you also live in a more rural area.
Hmm.
I remember you telling me how difficult it is to get care in rural America.
Absolutely. There is the communication issue between doctors to, for having to travel a long distance and then getting your small doctor who is taking care of an exorbitant number of patients and has no time, communicating with very large healthcare systems. I had mentioned to you that I had worked at a small hospital in Kansas 10 years ago, or say, I'm sorry, 14 years ago now. And they were a 100% paper system. And that does still exist in this country. Whereas they don't have the money to get an EMR system, regardless of how small. And even if it's a free system, they don't have the resources to get everything scanned and into that system. And then they have to come up with ways that they're going to protect that care. While they're scanning those charts, what if there's a flood? What if there's a hurricane? What if there's a tornado? How do they have a backup system for that paperwork? I'm sure you remember a big tornado back in Joplin, Missouri,
Yes.
probably 14 years ago, around that time now. And, we were requesting paper records from them for a DOJ investigation, and they didn't have it because they were gone. The entire hospital, their system, all their patient records were gone. So, we eliminated, they were, obviously eliminated from the study, but this is a DOJ investigation. This wasn't just something that's going to go away, but it would have had to. And the patients today, whether they're poor and aren't aware that there is care existing, and they may have a wait, but there is free to low cost in vaccinations for children and adults in public health care environments. And there's actually a lot of help in a social work setting where you think of an older patient not knowing not only how to navigate Medicare, but then there's now the inpatient and outpatient network for them. They're starting to have copays in Medicaid
Oh,
that
wow.
patients can afford, but there
Right.
is help out there for them. They just don't know how to get to it. So there's no
Mhm.
blue book anymore in the blue page, in the white pages or yellow pages for them to go to say,
Mhm.
oh well, okay, if I'm looking for this, there's all these resources. There's
Mhm.
not a phone number for them to call that they're aware of. So
Mhm.
there's, they have to navigate not just that, but getting bills from doctors, and then the bills are very scant. Back in the day, used to get an itemized bill. Patients don't know
Mhm.
that they can call and ask for an itemized bill. They might
Right.
not be able to understand it, but they could take it to somebody who may be able to break it down for them. Then there is the issue of appeal. Do they know how to appeal? Do they know how many appeals they have? Do they know it can go through an ALJ level, which is administrative law judge level, where they can
Mhm.
actually fight this? Then there's the building up of healthcare bills where they can't afford to pay them. So they have to determine, okay, I get, $1,300 a month in Medicare or disability. Do I buy food this month, or do I
Right.
fight this? Can they afford to get their medical records? For a patient to get medical records out, it used to be so much upfront and so much per page. Now it's
Right.
$6.50. Patients don't know this.
Mhm.
I am a patient and did not know this. And I
Yeah.
worked in medical records
Yeah.
for a time in IT from a healthcare perspective. So I pretty much worked in every facet of healthcare, from the beginning of uh, working the front and back offices of doctors' offices to working in trauma, and then going on to public health. So I've seen it all, and even I am lost in the system.
I think
Having been
that's that's the biggest issue, I think. It's who knows how to work the system. And in order to figure that out, even from the inside. it's not apparent, it's not
No,
transparent, it's
constant
not easy to
changes.
access.
Right.
So what are you supposed to do? I've often said the reason I decided I really wanted to do what I could to help is because as I was going through this, I very well educated, I'm able to do research, I have money, I have two forms of healthcare, I could get a third if I wanted to, and I have time. And I made my health a full-time job.
It is a
But
full-time job.
I'm
Absolutely.
able to do that. My husband has a very good paying job. He was able to take care of us, himself. I was able to hand over my business to somebody where I was still making money, but I didn't have to actually put in that much effort. But what about the people who have two kids, an hourly job? So missing just 2 hours is the difference between making rent this month or buying groceries and, not being able to feed the kids. So what are they doing? This is so difficult, isn't it?
They don't have any recourse. They don't.
None.
One of my closest friends, he was a nurse and he developed long COVID early on before there were tests or
Hmm.
vaccines. And there's no way for him to prove it because he had had COVID so many times. Which variant are they looking for from a titer type of, that is where they take a blood test to
Hmm.
determine what is in their system. But being it 4 years ago, there's nothing in his system. So somebody like him had to get a lawyer, doesn't have
Hmm.
any money. He had to go back home. He doesn't have an automobile now. So everything gets stripped away to the point where they're dependent on their parents,
Hmm.
dependent on the, the state, and taking 4 years to get approved doesn't leave him with a whole lot to try to even get an apartment. I told him, look how expensive apartments are. I don't think you're going to be able to get one without
Hmm.
a cosigner or perfect credit scores. So
Right.
that's another thing. This healthcare debt gets put on the patients on which is horrible in itself, and they can lose their home and they can lose everything they have, and they can't fight it as well. They'll just, these big corporations, these big insurance companies will fight tooth and nail for $1,000 bill when they're only sending it out to get 60% of what was worth. But
Yep.
yet this patient has to fight it and go bankrupt because of it. And that in our country is scary because I too have the money, have the time. However, as I mentioned to you, I was just diagnosed with early onset Alzheimer's,
Yeah.
52 years old. So I can't do those things anymore.
Right.
Just
Right.
within the period of a year, I've gone downhill so much to where I can't even count money.
Yeah.
Whereas, I don't even have resources. I'm not at a point where at this point I can just hire somebody to take care of me. My husband was afforded the I'm sorry. See, those are words I forget. Um, his it's allowed by the state. The He can use his PTO to come take me to doctor's
Okay.
appointments.
Right. Yes.
Um, I'm sorry, I'm blanking on the word. It's the government's allowance of family members to take care of other family members.
Oh, Family Medical Leave Act,
Yes, see, there
FMLA.
you go.
Hmm.
Yes, the Family Medical Leave Act. So he can only use so much of his time to take me to appointments because I can't drive anymore. I live in a
Hmm.
rural area. There is no public transportation. There's no Lyft. There's no Uber. So he has to take me to all of my appointments, or it's I have to ask friends and family who live far from me.
Hmm.
If I was elderly, would I maybe there is something called Rover, but I'm stuck to one specific county. So they do this where counties can have transportation, but you can't cross county lines. I live in the middle of three separate counties. So I can't just see one doctor using this system. So once I get Medicare next year, I'll have two insurances, but I still won't have that transportation because I
Right.
can't Chester County to take me to an appointment in Berks County or Lancaster County per se. But for an older person, that is even going to be worse for them. They have to choose all their doctors in one county, whether they like it or not. That is not freedom of choice where it comes to healthcare
Hmm.
providers. So,
And for people like us, because we both suffer from autonomic dysfunction, which
mhm.
is a very specialized and rare, condition and finding a neurologist or a
Oh yeah,
cardiologist, often we need both, who can understand this condition is difficult.
it
It's
is.
difficult.
It is
I
very
live in the
difficult to
Washington,
find
D.C.
that.
metro
Yeah.
area. Almost impossible.
And I'm in the Philly area, and it was a horrible experience for me. I had to wind up going to Hershey.
Yeah.
The other thing is, as I had mentioned to you before, I am now moving to palliative care, but
Hmm.
it's required that I have palliative care with pain management. I cannot find palliative care with pain management, which is odd to me because palliative care goes hand in hand with hospice. You
Right.
can't go through hospice without pain management. So I can't find a separate pain management doctor to take me on because they don't understand autonomic dysfunction
Hmm.
and having autonomic neuropathy on top of small fiber neuropathy,
Yeah.
on top of chronic pain, chronic complex regional pain syndrome in my legs.
Hmm.
They're like, nope, don't want to be
Yep.
bothered. It's too much to take on. Go to palliative care. So it's one of those, we're going to push you off to somebody we know you can never get into contact with. So when
Right.
my primary has tried 5 different places and they're all like, sure, we're happy to take her in, but we don't do pain management. The entire opioid crisis has caused trauma to so many other patients, older patients I can't even imagine, cancer patients, including
Yes.
children. They
Yes.
cannot get the pain management that they need, or they got rid of abortion, so that there are actually drugs that they may use for an abortion, but they won't give to a 60-year-old woman who actually needs it for her medical condition because it
Right.
may cause an abortion. She's 60 years old. She's not getting
Yeah.
pregnant,
No,
but
exactly.
they have
Exactly.
non-doctors making medical decisions. Now, am I the type of doctor at this point that could write prescriptions? No, I don't need to be. I still went to medical school. I still understand everything they're doing, and I helped during COVID as much as I could. But unfortunately, I am a product of COVID and long COVID.
Yes.
So, but I also, like you, had issues with biologic drugs, for
Hmm.
which I'm still on too, and I have to worry every day. Are these things going to make me worse?
That
Or other
causes so much
drugs?
anxiety. Yes, that
Yeah.
causes so much anxiety. And, I keep trying to talk about this as much as I can. You are a doctor. I think it shocked me. I know it shocked me, because so often as a non-medical person, we're told over and over again, just do what the doctor tells you, just do what the doctor tells you. And then when I had this severe reaction and I found out the real dangers and risks that are associated with so many medications that we take and we don't even think about it because they get a jaunty little jingle on the commercial and we can dance to it and we think, oh, this is going to be great. It's going to save my life. But, in my case, we were trying to use Humira to save my life because I have very severe Crohn's, and it ended up making my life far worse. And you've had similar experiences. And I always wonder, where is the responsibility? Because once I had that reaction, I was told all the way up to that point, just do what the doctor tells you. And then when I said, well, I can't, I've lost my entire life as I once knew it. I wasn't able to go to work. I wasn't able to do the things that I love. What happened? And then I was told, well, it's your responsibility to understand the risks of medications.
Hmm.
So we keep pushing off the responsibility. Whose responsibility is it for us all to understand what are the repercussions and risks of these medications and how do we get to the bottom of what we, you know, what's our risk matrix look like? I was in the army. Give me the risk matrix. How do I
There
risk
isn't one
matrix things?
anymore. There really
No.
isn't, because pharma has given up their responsibility by putting little words on a box saying, you know,
Hmm.
listen to your doctor. And then the
Yes.
doctor says, well, I listened to the drug rep. And then it goes back to the patient. So now
Hmm.
they put the onus on the patient to take care of themselves, have to do the research. And so they have these committees where they pretty much say, okay, if a patient has a severe risk, such as we did, now I was taking Humira for psoriatic arthritis,
Hmm.
which, there needs to be a black box warning on these drugs, like Timlos, which I'm taking for
Hmm.
osteoporosis. That
Right.
had a black box warning for osteonecrosis. So if I were to get dental work, they told me it's my responsibility to let my dentist know that I'm on this drug. And if they choose to do dental work, that there is the risk of osteonecrosis, which is, the dying of the bone of my jaw. So there is a high risk that if I go get a tooth pulled, that I could get this, but it's my responsibility to know that. And that takes away the responsibility of the drug companies. Now, they do have these little committees you can go to and submit, something for a lawsuit against them. But to fight against big pharma is not easy. And they might say, okay, we'll settle and we'll give, if it's a class action lawsuit, okay, we'll give each person $200, which does nothing.
Supposed to do, yeah. Like, how does it?
So I might have half a jaw and all these medical bills, but no one is responsible.
Nothing. No, that's the problem.
It's a major problem. They don't want regulations in healthcare.
No.
They don't want regulations, just like when you look at all the regulations against the big companies that Democrats keep putting on because it's the right thing to do. It's for the greater good. And then Republicans go and take it off because they want the money from the big corporations. It's push-pull constantly. So they'll take away the regulations, they'll bring them back, and vice versa. So they wonder, okay, why are we getting salmonella from chicken or E. coli for this or from that? Well, if you're going to have your waste from your big farms go into the waterway, it's going to cause problems. It really is. And here's an example. My best friend died of cancer at 51. I'm sorry, at 50. Her daughter then got a diagnosis of stage 4 breast cancer, just like her mother. 17 years old. The exact same thing, no family history.
Oh, wow.
So I started looking into that area and the local area to see what companies were around. Is it environmental? Were there power lines? What were those things? So, you have movies like that woman that went after the big...
Erin Brockovich.
Erin
Yes.
Brockovich. So I felt like Erin Brockovich. I'm like, I'm going to do all this research, and I was completely shut down.
Yeah.
They would not give me information. That's Freedom of Information Act. They still would not give me the information. So that pushes me to have to get a lawyer when all I'm trying to do is basic research to see if it's an environmental reason so that they could start a class action lawsuit. Now,
Yes.
I'll let you know, this was in a trailer park. My friend lived in a trailer park. Yes, I'm a doctor. I had a friend who lived in a trailer park. You can't control everybody else's lives, but that's not going to make me stop being friends with somebody.
Right.
However, when you have a lower socioeconomic area and the companies are doing this because these people don't matter to them, as though
That's true.
no one else matters. There's no rich company, no rich people living in there. There's no big houses in that area. So I got shut down. As a public health doctor, I got shut down. And it makes you wonder if someone like me is trying to research it, what if her family decided to research it? They're going to get shut down way sooner than I did.
As somebody who was greatly affected by an environmental event, I have Crohn's disease. I do not have a family history. We know it was caused by an environmental event. We know it was caused by burn pits that I served next to in Afghanistan. The only reason that I have healthcare focused on those things was, one, the hard work of a woman from Texas whose husband was also suffering greatly, and she did the work to get this started. But who took us across the finish line? It was Jon Stewart. It took celebrities saying, hey, you've got these 9/11 folks, you've got these military members, they're suffering, they're sick, you have to do something. I want you to know this right now. This is the truth. The military still uses burn pits. They don't just use them outside of the United States either. They're still using them in the United States, and they're all focused in areas with high poverty rates.
Because they still want to care. Yeah,
exactly.
You absolutely need celebrities, and who are the first people to tell celebrities to shut up? Republicans.
Yeah, every time.
They don't want anyone hearing the bigger picture. And it's not just you got burn pits, you've got food deserts.
Yep.
You've got the whole, if you go into an area, and I've worked in many of them, There are no supermarkets within
Right?
a
No healthy food to
very
be
large
found.
margin of distance. They
Yes.
don't have transportation, or they have to take the train, or if they take the bus. You can't buy, perishable foods, milk, and, maybe dairy products or fruit, and have to travel 3 hours on public transportation, expect it to get, home. It is it's the person's fault, person's responsibility.
Always.
They'll never give them cold bags to travel with. They'll never give them free transportation to get them home. And they'll say, oh, well, there's delivery. Sorry, but that $7 for delivery could mean the difference of someone getting a medication. Or,
Yes.
okay, that's their transportation money for the entire week, or that's all the money they have for the week. I've been there. I didn't get where
Hmm.
I am just because somebody gave me money. I started off as as a single mother on welfare
Hmm.
at 21 years old, and I had to figure it all out on my own. And there weren't really computers back then. Not
Yeah.
that not that the poor could access.
Well, and even when you have access to it, I mean, my goodness, like we've said, how difficult is this to figure out? It's a full-time job. It requires
Yep.
a lot of knowledge, education, and ability to figure out small and simple processes, or what should be simple processes.
And
And
I
it's
tie
just,
this
it's awesome.
all back to the 1980s when the Reagan administration got rid of all the state hospitals, closed
Mhm.
everything down, put everybody back out on the street, put the onus back on the families to take care of patients that they didn't know how to take care
Mhm.
of. Just
Yep.
like now, as a parent of an adult with autism, there's no real resources. There are, this is what we think, this is what we can do. Was it a big help for her? No. Did it get her in the direction she needed to go? No. But I did every single thing that I could for her as a parent. And then I got to the point where I'm like, there is nothing I can do. I need help. I absolutely need help.
What's so amazing to me is I've been going through this myself, learning about other people going through this, and of course, my time serving on the Virginia State Vocational Rehabilitation Council. Um, there's so much in this that is just detrimental to the economy.
Oh, yeah.
Maybe you could just look at, well, this person, is going through this, or this is, we don't know those people, they just need to move, or whatever it is you're thinking. Every level of this is bad for the economy. It's bad for the economy when I can't go to work because I'm waiting for doctor's appointments and it's 6 months at least to get into the next
Yeah.
doctor because we have a doctor shortage. Doctors are overworked. I mean, just name, I mean, we could probably spend an hour just talking about all those issues alone. And I have to wait 6 months to get in to see a doctor, and then I have to wait for the labs to come back because they don't order the labs until I've already been in the office. Couldn't we have done that when I was waiting 6 months?
Doesn't make sense.
And then by the time I finally get onto a treatment plan and can get back to life in general, I've been out of commission for a year. How much productivity is the economy losing? How much
Right.
productivity is the economy losing when doctors only know to say, oh, I don't know what to do for you if you can't get to work? Maybe you should just apply for disability? Well, how about we catch those people before they fall and immediately help them get back to real life? So it's
Right.
not just about doing what you love and your mental health and emotional health. It's also about being able to be productive. I don't think anybody really wants to live in poverty. I know everybody
Now,
thinks
I
that's what it
actually,
is,
I
but we
can
don't
give
want
you
that.
I can give you a story where not necessarily poverty, but there's people who want to be on disability and they don't do enough to get the people off of disability that shouldn't be.
Hmm.
For example, I used to work and run a hospital in Kansas City, won't name it,
Hmm.
and a lot of patients came in for bariatric surgery. And
Hmm.
getting and talking to them, doing sleep studies with them, and letting them know that, once you have weight loss surgery, you are going to be reevaluated once you lose weight to determine whether or not you can go back to work, which is always going to be a yes. So
Yes.
if your health improves after losing weight, not that everybody's will, because I lost a lot of weight. I weigh 96 pounds right now, and I'm still diabetic. I'm not
Hmm.
overweight, but I still have, a good 12 healthcare conditions that stop me from working. So I'm not saying in
Hmm.
every condition, I'm in every situation, but there were a number of patients who would withdraw from the program because they did not want to go back to work. I am not
Interesting.
one of those people. I would give anything. I
Oh,
would literally give my all my intestines to go back to work. Will I be good enough after that? I doubt it. But if I were to feel up to it, I would absolutely give up short-term disability, long-term disability, and
hmm,
Social Security to go back to work. I loved my job. I loved working. I
yeah,
don't understand why some people feel the need to not want to work, but I don't think that's a large proportion of the country. A
yeah,
lot of us want to feel productive. And even though I can't work, I can't drive, if there's some way that I can be productive, even if we had free help or volunteers, somebody like me who could help an older person navigate through a system,
yeah,
maybe there's some type of, government grant given to, allow people, excuse me, like me to answer phone calls for patients that have questions. And it's
right.
not going to be elderly patients most of the time. It's going to be young patients, or it's going to be a foster parent that's taken on kids that doesn't know how to handle doing all that or doesn't have the time. Maybe we have a resource center online that they can ask, even if it's just electronic questions, or ask questions that anybody can jump on and give an answer. But it has to be people that, there's Reddit. Why don't we have like a healthcare Reddit that other people can jump on and say, hey, I know about that because I used to work in that industry. I can give you this, or I work in this industry and I can help you understand how to put an appeal through. It
Mhm.
doesn't take a lot for us to give 5 minutes of our time to let somebody know this is how you do it. It's not that difficult. We'll walk you through it.
Well, I
Give
think
somebody
what's,
the peace of mind.
yeah, I think what's frustrating to me is I know that we can do it. Having worked in some form of policy for a good portion of my life, understanding government, federal government, and how we can work things, we do have a uniformed health services
Oh, yeah.
branch. And most people don't even know they exist. They just think military, Marine Corps. No, but there are uniformed doctors out there. They're not in a defense military position. They're just doctors. And the focus of that entire organization is supposed to be to help rural Americans get health care. In addition to some other things like public health, obviously they took a much larger facing role during COVID, but we have an organization there ready that we could just plus up and deploy to these rural areas. And there's just so much we could do within that. Provide people scholarships. Do you want to be a doctor? Okay, I tell you what, free medical school for you. You're going to serve 8 years in this uniformed services, and you're going to help rural Americans and bring healthcare to them. We have the mechanism there to do it. We're just
Yeah.
not doing it. And that's what's
That was what I was
frustrating.
supposed to do. That's what I was supposed to go to Fort Hood, Texas, and be a doctor. It's what I've always
Mhm.
wanted to do. But I agree with you. It does exist. But then now you have the era of trust. They don't trust
Well,
doctors. They don't trust, especially public health, and they don't
yeah,
trust people to tell them what's best for them. They want to listen to Joe Rogan, or they want to listen
right.
to different people on the radio, or these crazy zealots saying don't get vaccines because Wakefield wrote
Oh,
this
yeah.
article about autism back in the late 90s, and even still they don't know that it was debunked so many times. It's been
Yes.
tested thousands of times and debunked, and he was totally discredited, but yet that's what stays on their radar. And California, being one of the biggest liberal states with getting vaccines, is now, just from the southern area of LA and going down, they are now having the highest incident rates of polio and
Mhm.
chicken pox and smallpox. Why? Because of ignorance. It's just unreal.
It is.
You were mentioned about that. They need to get out there and they educate, not just help, but educate. It's a
And they
shame.
need to be transparent. I think that is one, as I've gone through this, I think it's very easy to look at somebody and roll your eyes and say, oh, they're so stupid. But I think a lot of what's happened is there's a lack of transparency. I will, just being frank, I will never completely trust the healthcare industry again after what happened to me. And I had a lot of trust. I walked into this with trust, believing. And now I realize that there's a lot wrong. Now, of course, having as much experience as I do working with government, I can easily see what's going wrong and what's happened. I can clearly look at something and say, okay, well, obviously, all vaccines are not bad for you. However, what was never discussed as we were going through the COVID vaccine, for example, because that one's still fresh, is it sometimes that vaccine did cause the autonomic dysfunction that we have. It wasn't what caused mine, but it did cause it for some people. So they feel lied to. And then once they feel lied to, you start to get that mistrust. And if you're somebody like me, you spend hours, weeks, months, years researching, figuring out what to do. But for many people, just like we talked about, they don't even have time to take an hour off of
Right.
work. They're busy. They've got to get the kids to healthcare or to childcare somehow. They got to get to work. They cannot miss an hour of work. They're going to a second or sometimes a third job. They maybe have a high school education. They don't have time to sit around computers doing extensive research for hours, weeks, months, years on end. So instead, they see a Joel Rogan podcast and think, well, there it is. And now we'll
Right.
never trust those people again. But you're never going to get it perfect. You're never going to get everybody to
Yeah.
trust you. But if you're transparent and you're being honest and you're doing your best, you're going to have far fewer people saying, you know what, I don't trust this organization. It's much harder to hook somebody into a conspiracy theory when they've been well served by those industries,
Right.
people, organizations that are the focus of a conspiracy theory. That's my point of view
Right.
on the whole.
No, I agree with you. But there's lobbyists for the
Oh,
healthcare industry, for the pharma industry. Where are the lobbyists for the patients?
yeah,
Where is the support and the admiration and the love for the patients? It doesn't exist.
no.
Nobody's
It,
stepping up and saying,
well,
it's supposed to be for the people, not for the organizations. And somebody had mentioned it to me and made the most sense, said the United States is a business. But then
it
somebody
is.
else said on top of that, the United States is a shell corporation. And that
Mhm.
really resonated to me a lot
Yeah,
because
yeah,
it makes more sense. And back since Halliburton and all of the things that happened then, they don't learn from their mistakes. And all there needs to
yeah,
be is a mechanism or something offered by the government, supported by the people. I mean, like Wiki exists to help people. you
yeah.
know, why isn't there a healthcare wiki? Or why
We need
isn't
it.
there,
And we could
a
fund it.
free system? It could exist. All you
Yeah.
need are a bunch of developers to open up their time for people. And then healthcare people getting on there, giving the honest truth, and then having other people who are willing to donate their time to say, I will man the desk per se,
Mhm.
from 6 to 8. And then other people, if there are hundreds of thousands of people willing to donate their time 2 hours a day a week or something like that, there's no reason why this couldn't be successful. Or the government, allots money to allow for government employees to do it. But then there's that trust issue and the transparency
Yep.
issue, because you're going to
Yep.
need a different set of people for the VA, different set of people for people out of the military and using TRICARE, people using Medicare, people using Medicaid, and then people
Mhm.
using all different types of private insurance, because they all have their own rules.
They
It's
do. And
just
I tell you what, the truth is there are lobbyists for the people. There are. And I always say to people, because I talk about the burn pits a lot, it's changed veterans' lives, getting this health care that we need. And everybody thinks about Jon Stewart because he's the big face, and goodness knows we love him because it took his celebrity. But it was one woman, a military spouse down in Texas, that did the hard work to get this started. And the people that took it across the finish line, that was MOA, the Military
oh wow.
Officers Association of America. MOA does great work. And there are other organizations like MOA here in the DC area. There are plenty of them. I know these people, they're great. They do outstanding work. But I'll tell you what the difference is. These people who are lobbying for just you and me, they're smaller organizations. I actually interviewed with MOA back when I was considering, getting back into just the regular workforce and working for somebody again. And I was surprised when they said that they needed, something to really build because, they weren't in the best position. And I thought, you're the best organization in Washington, D.C. They've done so much for us. If you've ever served in the military as an officer, you should join MOA because they're amazing. And it's the same with many of these organizations. They're small. They don't get all the funding that the big corporations do. You're a lobbyist. You're making, 130, 140,000 a year. I know in rural Pennsylvania, that's, I'm sure a lot of people think, oh, that could be good, but not, you're suffering if you're making 140,000 a year in DC. And oh, guess what? Big Pharma's paying their lobbyists seven figures a year.
Yeah.
So that's the difference. And so they're there for us, but you're up against some really, really big organizations, some heavy lifts, and you're just doing the best you can. And I give those people in DC all the credit. Every time I speak to somebody who doesn't live here, I say, look, I know, it seems, people talk about a swamp or this or that, but there's a lot of people here, and they're the people who aren't making much money, and they're getting up every morning and they're just operating on passion, and they're getting up there and they're doing everything they can to try to help us. But it's a tough job when you're
I'm
going up
sure.
against big
I see.
pharma.
I wasn't even aware of it because it's just not something
No.
that's made aware to people. It's not like they're giving out leaflets and letting people know that this is
Yeah.
available to you. Now, I mean, that's something that wouldn't have been available for me, but I'm glad that I can help the people that are in my life, whether it's friends, families, neighbors, even
Hmm.
strangers, or if somebody refers somebody to me and says, there's this friend of mine and they're dealing with this surgery and they're not sure where to start, or they need this, or they had a medical injury because of this. Well, I'm not a lawyer, but I can certainly do the research and find out how many times this has happened before, or if there's
Yeah.
other lawsuits that exist, or if there's class action lawsuits based on that material that was used. Anything
Hmm.
that I can do to support a patient to get where they need to go. I might have to tell them, sure, you need to get a lawyer, but here is the proof that you need it.
Yeah.
And this is a start. That's all I can do as a, patient who is no longer stuck on the stuff on the floor. I have a stair chair now, which is nice. But,
Yeah.
you know, there's no reason why somebody that that hasn't gone to medical school, that has not, you know, eat, I can't even say that with the Alzheimer's, I don't get confused at this point, but I don't even have help. Like, my husband's in healthcare. He can help me some, but he's too busy to do that. There
Hmm.
needs to be more for the people. There has to be
Absolutely.
resources out there. And I'm scared.
Absolutely.
I'm scared for the future. I'm scared
Hmm.
to know how bad healthcare can really get if somebody gets in that, doesn't even want the ACA around. The ACA
Yeah.
is helping a lot of people. Is it the
Yeah.
best? No. Can it be expanded upon and made better? Absolutely. And
Absolutely.
that's really what has to happen. If it's completely ruined and taken away, where are we going to have patients who don't have $1 million limits on how much care they can get, which is like nothing today.
Yeah.
One patient falls down the
No.
steps, breaks their neck, and needs massive surgery. That's it. They're bankrupt. They're going to lose their house. They're going to lose everything.
Yeah, exactly. I tell people all the time. I'll hear people say, "Oh, how much money are you saving? You can't take it with you." And I say, "Well, that's true, but and like we've talked about, there's a certain party that really wants to actually take away many of my benefits as a veteran. If I have to pay for my medical care on my own with all these health issues, it's no small amount of money. It's millions of
No,
dollars.
not, I
So,
mean,
yeah, I
I
save money
totally
a
get where
lot.
you're coming. Now
Yeah.
I need surgery. I need a massive surgery that's going to be 70, $80,000 on top of ICU and all the care that I'm going to need
Yeah.
after. Now I want it done by the end of the year. If I have to wait until January, I'm going to have to come up with $15,000 because that's what they want. Everything paid up front. Your deductible, your copay, and all your out of pocket
Yeah.
maximum. Now, being out of work, do I have it? Yeah, it's in savings, but I would have to take all that money out and give it to the hospital, and that's my tax money because they don't
Yeah.
take taxes out of my long-term disability or my Social Security. So I have
Yeah.
to come up with them all my taxes on my own, and I don't have that kind of money. I'd have to charge it.
Yeah.
So from paying hospital bills all year. So now that I'm on a very fixed income, on top of, my regular pay, I can't come up with that money right away. So then I'd have to wait even longer for the surgery. And if this
Yeah.
one surgeon I'm seeing doesn't want to do the surgery, I have to start all over again and find a new surgeon who's going to have to go and do all the same things and go through all my records,
Yep.
and older patients, they're all high risk. They all have this
Hmm.
issue,
Yeah.
and they don't have the money, and they keep increasing the amount of money they have to pay, both in taxes, in some states, how much they have to pay for their own care. Medicare Advantage isn't cheap,
Nope.
so now they have to determine still, do I want to pay for, benefits through this, or is GoodRx better? And only pharmacists tell them about that. I had that experience this past week. I need Zofran for
Oh,
nausea.
hate that
It's
stuff.
that bad. So my
Hmm.
insurance will not pay for it. Why?
That's
Because I don't have
amazing to me.
cancer, but I have
Yeah.
a very horrific GI issue that causes that. So if, an older person doesn't have cancer and needs it for, it's prescribed by a doctor, why is the insurance company saying, no, you shouldn't have it? I mean, if this is what we've tried, we already did all the alternatives,
Yeah.
and they're saying, no, we're not paying for it. So my doctor said, find out from the pharmacy how much it is with GoodRx. It was $20.
Yeah.
So now I'm
Good
paying with,
RX is great.
I am not using my insurance for GoodRx, for Zofran. I'm just going to use GoodRx.
Yeah,
It's sad. It's so sad. My
it
doctor
is.
says I need it because I can't function with having
I
that
get
level of
Zofran
nausea.
all the time because, well, the autonomic dysfunction. It's
Yeah,
just, I mean, and this is coming from a Crohn's patient. The hell it wreaks on your GI system. When a Crohn's
it's
patient says that, folks, pay
it's
attention.
bad. It
It's
is real
terrible.
bad. It's like pregnancy nausea, and I know you said you didn't have kids, but anybody who
Yeah.
has kids, pregnancy nausea is so bad. This is 1,000 times worse.
Hmm.
And
Yeah.
you take a Zofran. I don't know about you, but I take a Zofran. It actually makes it worse before it
Oh,
makes it better.
yeah. Oh my God, everything's just a mess. It's
And then,
just,
but I will die without it.
yeah,
I absolutely need it. And if a doctor says I need it, the insurance company shouldn't say, no, I don't think you need it. And I actually worked for insurance companies because I wanted to see that side of it. And I've worked
yeah,
with doctors that have had to do that. And I've been on peer review calls where that has been an issue, where you automatically start arguing back and forth about guidelines and stuff. So whereas
yep,
the insurance company is following strict guidelines, only guidelines, from Medicare, there are 1,000 other studies that, doctors could pick up and say, well, this study was done and this study was done, and it proves that we don't care. This is what the guidelines are, and that's it.
yeah.
They
I tell
just
you what,
make decisions.
I think we need to do a series because
Oh,
there's so
yeah.
much to hit. We just don't have time today. From the insurance companies to how we're not utilizing the uniform services well to needing to put forward something. I mean, my goodness. I mean, I was in Department of Defense. I'm used to having unlimited funding almost, So coming to this world and seeing so little put into something that means so much. And again, I can Republican the heck out of this if you want me to. I can Democrat the heck out of it. I can Republican the heck out of it. We can improve the economy if we get the people healthy. So I think
Absolutely.
we need to really, dive into this for a few more episodes because I still want to
I
learn
totally
more
agree.
about how you're doing. And, I remember us talking when we first spoke, my goodness, two women like us with graduate degrees and professional careers, and we're both saying the words, thank goodness I married somebody who could take care of me. I mean, it's just horrific to even consider, that
It
this is where
is.
I've ended up in life. So we have a lot to talk about. So I know, we got to get our own series going here because I think we could talk for weeks about this, months.
Oh,
But thank you
absolutely. You
so
break it
much.
down piece by piece. Absolutely.
We have so much work to do. But thank you for coming on. I know how difficult this is. It's when you've had that experience of dealing with chronic illness, and you smile, you look great, you feel terrible. So I know
Yeah,
that you're
it's
going through
exactly
a
that
lot.
way. I
Yeah,
got on no
yeah,
matter what. I didn't want to disappoint you again. And yeah, it's a bad day, but you know what? I put my smile on, take a few pain medications that I'm prescribed that I never take, and get through the day. That's the only thing I
yep.
can do.
That's right. I always tell people if you want to meet somebody really strong, instead of constantly seeking out that Navy SEAL or that, Army Special Forces guy, come find anybody with chronic illness, and you're going to find that one of the strongest people you've ever met in your life.
Damn straight.
Every time. Well, thank you so much.
Thank
This is
you.
Dr. Tara Palumbo, and we will be doing a series out of this.
I love it. Thank you.